Welcome to Seniority Authority, the podcast where I track down experts to answer your questions on aging. I'm your host, Kathleen Toomey. Let's get smarter about growing older. Have you ever been faced with a tough healthcare situation and needed someone to help you figure out your options? Were you even aware that there are people trained to help you in these situations? Our next guest will fill you in on exactly what this role is and how you could find help. Aileen Gerhardt is an independent board-certified patient advocate, BCPA, and founder of Beacon Patient Solutions in Brookline, Massachusetts, which she established in 2011. She created a national network for solo agers, as well as a free online tool, and hosts a number of community education workshops. A graduate of Brandeis and Clark Universities, Aileen received her certificate from the University of Wisconsin's Center for Patient Partnerships in 2017, when she began her work in patient advocacy. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of nonprofit retirement communities, where active adults find community, purpose, and peace of mind. Visit riverwoodsgroup.org. Now let's hear from today's guest. I'm so thrilled to have you on Seniority Authority, Aileen. Great to see you today.
Thank you very much.
Let's start by telling the listeners what drew you to this industry. This is something that you didn't come out of school deciding that you were going to be a patient advocate. What was your journey?
So I actually am trained in student affairs and that kind of work. I served as a advocate of sorts on campus, working with students and faculty, etc. And after about a 17-year career, my mom had a major health event. And in having the health event, our family had never experienced anything like that before. We weren't well versed in the healthcare navigation system. And we were really fortunate that through this significant event, the professionals who we were working with really lifted us up and encouraged us to ask more information and ask when we didn't understand something, etc. And the whole process of supporting my mom and my dad and my brother taking part as well really showed me how draining it can be when you're trying to advocate for a loved one as well as being emotionally connected. And so I made the decision to switch careers really as a pay it forward decision, that we were really fortunate to be lifted up by so many wonderful healthcare professionals and staff, and they really taught us and held us up. And I decided that if I could ease that burden for someone else, even by 0.5%, the way those folks had done for us, that was something I really wanted to do. My training wasn't in that, so I needed to formalize, or I felt I needed to formalize it. And that's how I had the opportunity to get my consumer advocacy certificate through the University of Wisconsin.
Wow, it sounds like that was really a transformative experience for your family and really changed your life's direction.
Absolutely. Absolutely.
So I think some of our listeners will be confused as to what a patient advocate is and what it's not.
Gotcha.
Let's dive into exactly what are the boundaries of a patient advocate.
So just to complicate things a little further for your listeners, so there are patient advocates that you'll find working for insurance companies, healthcare facilities, care facilities, etc., who are employed by that particular entity. And then for me, I'm an independent patient advocate, meaning that my employer is solely my direct client. And so my allegiance and my work is done solely under the direction of the client. And I don't have any conflicts of interest that might come about regarding employment through other facilities. So that's one piece of it. An independent, in my case, board certified patient advocate is someone who helps people navigate the complexities of the healthcare system, whether that be in a clinical setting, in a care facility setting, on the medical billing and insurance side, all of those different pieces. I always say that I don't make widgets. My product is information, that I help my clients secure reliable information so that they can make an informed decision that reflects their values and needs.
Awesome. So could you give me an example? If there are patient advocates in the hospital system and working for insurance companies, why would you need your own patient advocate?
So the folks working in the various insurance companies and other facilities are excellent advocates for the patient or the patron of the insurance company. However, they often can only accelerate or anything as far as their employer will allow. And so there can be a barrier in terms of going farther, and a client might need something a little more than what they can offer through their particular employer.
And that makes sense. So if you're working for one entity, your answer is always going to be whatever that entity can offer. But if you hire a patient advocate for yourself, that patient advocate is looking out for what are the entire constellation of solutions that we could bring to solve this person's dilemma.
Absolutely. That also gives people the ability to put their efforts towards healing or navigating or understanding a new diagnosis. And it also gives people peace of mind that a professional is coordinating all of those details that you just referred to.
I always dive into the practical because that's how I roll. And if my listeners were nodding their heads and saying, this sounds good, can you clarify for me? It sounds like you would hire a patient advocate when you are in the healthcare system, when you are in a hospital, in a long-term care community, about to exit a hospital and needing some support, and or dealing with hospital and insurance bills. Would you hire a patient advocate if you are at home?
You certainly could. If you had a new diagnosis and wanted reliable information to make some decisions about that new diagnosis, you would hire a patient advocate. If you have a complex medical history and you're trying to coordinate various members of a healthcare team, if you're somebody who's overwhelmed by the medical bills you've referred to, as well as exploring a clinical trial or a second opinion. Those are all reasons people will reach out to an independent patient advocate to help them with coordination, with information, and identifying reliable information to make their own choices.
Good. So we're getting clear on what a patient advocate is. There are also, just as we get clear, there are also complicating factors. So there are geriatric care managers. What is the difference between a geriatric care manager and a patient advocate?
Right. So geriatric care managers have rebranded themselves. They are now aging life care managers, also referred to as geriatric care managers, of course. And when it comes to a patient advocate's work, I work with people along the entire age continuum with a direct focus on navigating healthcare. So, but a care manager, an aging life care manager, can have a breadth and a scope of work that involves assessments and medication management and help with exploring housing options and assessing what's needed in the home and all of that. And of course, they serve as an advocate, as we all do, right? We want the best outcome for our clients. And they also do help with healthcare navigation. but it's also an excellent opportunity for a care manager who's experiencing that breadth of case to tap into and partner with a patient advocate for to be able to dive into those healthcare pieces. Possibly a little more quickly, certainly a little more confined than the whole case, and vice versa. If I'm somebody that, after working with a client doing that, realizes someone needs the help and assistance of a care manager and the scope of what they offer, I will refer to a care manager as well, or partner with.
Okay, that's great. I really appreciate it, because there's a lot of different titles out there. And it's good to be clear. Can you share a story about a client of yours and how they used your services? Help us kind of draw a picture of what it might look like to work with a patient advocate.
Okay, so I'm going to go with an elective planned process, as opposed to when something might come up unexpectedly and people are in crisis, and it may look a little different. But let's say you're having a knee replacement, and you need to need to verify that the hospital at which you're having the surgery is in network and covered by your insurance, and the provider who's doing the surgery is covered by insurance. Those are actually two things to consider. Sometimes people aren't aware there's also facility fees and coverage. So just right off the bat, having that information and having someone who can identify and secure that information is helpful while someone is preparing for knee replacement. Throughout the time after surgery in the hospital, if they're an inpatient, there's coordination with the care team, helping with the planning for transferring to a rehab facility. And then once that rehab facility has been designated, then I work with the client and meet with the care team at that rehab facility. So now we're at a totally different facility. However, the continuity of support is me as an advocate. So I'm able to work with the excellent social workers and nurse managers and everyone at the hospital. And even though they really want to know how my client did with their knee surgery, they're not able to follow them to the rehab.
And you provide that consistency.
Right, that continuity. And then it continues along with the planning from leaving the rehab facility to home, what resources might be needed at home, what's covered. All of that coordination of detail and planning is something I work with people on frequently. That's a fairly common experience as a patient advocate.
And as you relate this story, it makes me think, I am a solo ager, and this is something that if you are a solo ager, you would really need someone to help you navigate some of these things. And you have become quite an expert. This has become kind of a niche of yours, solo aging.
Mm-hmm. Absolutely.
And did it start out that way, or did you just kind of fall into this?
It evolved through the community education work that I do, offer talks on a number of topics and work with clients, again, along the entire age continuum. But as one ages, we tend to access the healthcare system more.
Mm-hmm.
And so I would find that I was working with folk who didn't have someone to identify as a healthcare proxy, or someone who didn't have an emergency contact. And it would occur again and again. And between the community education components of solo aging and working directly with clients, it became clear that there were many resources that this population needed that were unique to them, that weren't being offered or needed to be expanded. And so in doing that and realizing that, I was able to really embark on a focus with solo agers and working with solos throughout my work.
And what I think is such a great gift is that not only do you work with solo agers, but also do a lot of community education. You have some recommendations for solo agers, no matter where they are. And one that I thought was fascinating is to create a micro board of directors.
Right.
So can you tell us a little bit about that idea?
Sure. So the idea behind that is that everyone as they age definitely needs to plan and needs to have a strong support system. Often people who are married, partnered, have adult children, often or other adult family members have that layer of support they can rely on. As solo agers, folks who didn't have children or are estranged from children or unfortunately outlived children, that extra layer is not there, which means there needs to be an intentional approach to making that layer and that support available. So when you think about a board of directors for an organization or a corporation, everyone around that conference table that we can all envision in our head, right, is there because they're interested in the advancement and the support of that organization or corporation. And everyone deserves that individually. So it's the same mindset. It's the concept that you have formal and informal support, friends, if you have extended family members, and then being able to identify professionals who might be helpful around the table, a patient advocate, a care manager, a financial advisor, an attorney, all of those different pieces. In other parts of the country, we're in Massachusetts, but in other parts of the country, people can hire fiduciaries, and they're an excellent resource to be on a healthcare team, on a support network team. Unfortunately, we don't have that currently in Massachusetts, but those folks can definitely play a significant role in support. And so the concept is who's around your table. I have a graphic in one of my slides, literally that. Who's around your table? Who are the people who come together for your board meetings, monthly or otherwise, and offer you support that you need with your best interests in mind?
If you're getting smarter, help us reach more minds. Leave us a rating and review on Apple Podcasts. Tell your friends to follow us on social or subscribe to our newsletter at seniorityauthority.org. Well, and I think the other idea that is really helpful is to create this little gang, this little board of directors before you need anything. And you can offer to do it with each other. You can, if you have friends say, hey, I will help with your finances if you help with my, keep my healthcare choices in mind. So I think doing it sooner is better. And this is one of a list of tips that you have for solo agers, right?
Absolutely. Planning is critical, and always planning for something before you need it is also critical. So, for example, when I talk to people about planning for emergencies, right, that can sound like an oxymoron. How do I plan for an emergency? And the reality is we can't control what the situation is, but we can control how prepared we are for it, how we react to it, and what resources we have gathered. So one thing that became something that a lot of patient advocates, and I certainly am one of them, related and focused on solo agers, are for people to put together a go plan, right? A plan of, if I needed to go to the hospital, what would I need in a bag? What would I need with me if I couldn't speak for myself and I didn't have other members of my support team? And this was particularly relevant in the height of the pandemic. Is there a piece of paper I can have with a list of medications and that I wear glasses, or that I use hearing aids, or that I use a walker, or my blood type, or whatever? In addition to extra phone charger and extra mini toiletries and all of those things, so that I am prepared. And the idea of planning ahead regarding that which we can is really important. It's also empowering, right?
Oh, sure.
We don't feel as out of control because we've managed a situation to an extent as much as we can.
Yeah, I think that makes a lot of sense. And since we know We are all living longer. And there are, I think the statistic is 60% of us over 70 are going to need some form of long-term care. We know we are going to have hospital stays, so let's plan on that. Based on your experience, are there one or two things that you would suggest that my listeners always do to prepare for the future?
So not only is that planning piece critical, and that's a plan related to healthcare navigation, your everyday healthcare navigation, and the emergency piece, housing, legal matters, advanced care planning, financial matters. So here are the other two pieces of this. So have a plan, but here are the other two pieces that people often either forget or don't do to the full extent that would benefit them. One is revisit that plan. That's a dynamic plan. It's not I've put it together and I put it on a bookshelf kind of plan. Or when people say to me, I have this plan and I put it safely in my safe deposit box. Fantastic. I hope it's a copy.
Yeah.
Because it should be easily accessible to certainly your healthcare, right? Legal matters, not things like wills or investments or any of that. And so it's revisiting that and seeing it as dynamic and making changes as needed when there are significant life events or you've assigned people as particular powers of attorney or other agents, and they're no longer able to do that for whatever reason. They've moved away. They have their own issues, something like that. And then the other piece that people often have the greatest trouble with is once they've put together that plan, and if I'm fortunate enough to remind people so often that they do it, is revisit that plan. They also have to tell the people that are on that board of directors, in that support system, what's in the plan.
Yeah.
Right? Someone cannot advocate on your behalf without knowing what you want and what you don't want. And that relates to all of these topics: housing, finance, legal, healthcare navigation. And so that seems to be the piece that's the hardest for people is, okay, I've put this together. I've worked really hard. I've written everything down. I've pulled my paperwork all together. I suggest people keep it in a binder, but I can understand whatever filing system works for you, whatever organization system works for you. But then once you've done that work, do yourself the favor and honor of honoring that hard work and making sure that the people involved in your support system truly know what's in that plan and hear it from you directly. So there's no guessing and there's no wonder.
Yeah, I think that's really smart. And just the very fact of, if you put the plan somewhere, tell somebody where it is. And if it's on your computer, what is the password to your computer? Don't lock it away.
Right.
If somebody, because we have a national listening audience, if someone was interested in finding a patient advocate, you work with clients nationally, you're based in Boston, work with clients nationally, but where would someone go to find a patient advocate?
An excellent question. So people tend to either Google the phrase healthcare advocate, patient advocate, which can yield all different kinds of search results as anything on the internet can. But more productively, if you live in an area that has a regional group, for example, we have a Massachusetts Healthcare Advocates Group, abbreviated MACA, although we're all of New England. We have our own website and business directory of folks that are in the New England area. So there are other regions around the country that have that as well. There are also national directories through national organizations. So I am on the board of directors for the National Association of Healthcare Advocates, abbreviated as NAHC, NAHAC, and there's a directory on our website to be able to look up patient advocates as well. If you're looking for a board certified patient advocate and that credential, the Patient Advocate Certification Board, which is a certifying body and is not a membership organization, has a list of the now 1,040 board certified patient advocates. So that's since March of 2018.
Wow.
I took the board certification. I was in the first cohort and fortunate enough to pass. So since March of 2018, there are 1,040 board certified patient advocates. Now, they're not all independent patient advocates, right? They work in care facilities and, the places we talk, veterans associations and insurance companies, et cetera. But they want that certification, be able to sign on to that standard of excellence and of ethics, and really be part of the community of patient advocacy. So that's another place you can read about where people who are board certified.
That's great. And we will provide links to all those sites in the show notes, as well as a link to Aileen's website, so you can reach her directly. You have been in this industry for a while, and I'm sure you get stumped. What is your go-to resource when you are trying to track down a question, Aileen?
So I am very fortunate that living and working in this area, I have a fantastic network of colleagues, both advocates, patient advocates, and other professionals who can offer outstanding resources, ideas, and advice. And that happens nationally as well, which is fabulous. And then there are other national organizations where I feel that that's where the National Institutes of Health, places like that, where they're the Center for Medicare Advocacy, which is in Connecticut and Washington, D.C., and has all kinds of great advocacy resources related to navigating the challenges of healthcare. They're an excellent resource as well. So those are two, besides the colleagues and the wealth of information I'm able to access that way. I tend to go to the most reliable and knowledgeable of resources, especially when it's related to the client's need and making sure they have the best information possible.
Absolutely. That's awesome. Well, we already know that you are a very compassionate professional and you create your own business, but now we want to get to know you a little bit better. So this is the fun part of the podcast. I'm going to do a fast 5 lightning round, and we're going to get to know you a little bit more. So what is your guilty pleasure?
TV comedies or any movie comedy-wise that I've seen multiple times and can just be on as white noise. It gives you the chance to step out of yourself, which is always nice, and decompress.
Yeah, it's important to do that, especially because you are dealing with a lot of heavy topics on a day-to-day basis. Of all the things that you do, what's your favorite healthy practice?
My favorite healthy practice is actually walking. And I actually have combined that now with nature photography, which is something that I taught myself in 2020 when being outside was the healthiest and safest place to be. And I already enjoyed being in nature. And so I combined the two and tried to be as mindful and present as possible, even while taking pictures. But while walking, I don't use headphones and I don't take phone calls.
So that's great. Yeah. That is great. Yeah. So you can really absorb the experience of being in nature.
Absolutely.
And what's guaranteed to make you laugh?
Any time spent with my niece and nephew. My nephew's 10 and a half and my niece is 6. And they are the joys of my world. And time spent with them just makes me absolutely delighted. So this tells you about my work-life balance, right? So a lot of them have been solo aging books, right?
Yeah.
To make sure that all of my presentations and information are as accurate and well-sourced as possible. So nothing too titillating or exciting in that kind of realm. Mm-hmm. No beach, books, more staying on topic.
Awesome. So like Sarah Zeff Geber's book on solo aging.
Sarah Zeff Geber's book, which I consider a solo aging Bible. Carol Merrick's new book, Solo and Smart. And Joy Laverty's book, Who Will Take Care of Me When I'm Old. Those are both 3 outstanding books that I spend a lot of time rereading and perusing and also Elderhood by Louise Aronson, which is an outstanding.
That's a brand new book. Yeah. That's very cool. I talked to Carol when before Solo and Smart had published. So I have to revisit that again because she's terrific.
Fabulous. And those folks are all the trailblazers in solo aging. So the work I am doing is simply just building on the foundation of what what they have done and what they continue to do. And so I am very grateful to call them colleagues. I'm fortunate to know them, all three of them, very well.
That's fantastic. And if you could choose, what's your favorite escape?
I think anything in nature, anywhere I haven't been before or anywhere I can revisit. And, no two visits are the same. And being in nature's house and knowing you're a guest is really a very soothing thing.
That's awesome. Awesome. Well said. And it's a great place to find a little peace and tranquility too.
Absolutely.
Well, Aileen, thank you so much for sharing and guiding us and really helping us learn what you do and how we could possibly use patient advocates in our lives. I think part of what is challenging for so many of us is what we don't know about the help we could receive, and that you don't have to necessarily figure it out all on your own. So this has been a wonderful conversation and a wonderful opportunity for education for a lot of us.
Thank you very much for having me. I enjoyed the conversation as well.
It was great. Well, thank you so much. Thanks. That's our show for today. If it helped you think differently, would you help me? Go to the Seniority Authority page on your podcasting app and hit either the plus, heart, favorite, or subscribe button so you don't miss out on the next show. And tell your friends so we can spread the word. Until then, enjoy the chance to get smarter about growing older.